Namaste, I'm Dr. Kaveri Nalianda. I work as a consultant rheumatologist at the Center for Arthritis and Rheumatism Excellence at Kochi. Today I'm going to give a brief but general talk about arthritis. So what exactly is arthritis? It is nothing but inflammation of the joint. Broadly, there are two main categories. One, an inflammatory arthritis, and the other is a degenerative or a wear and tear kind of arthritis. Inflammatory arthritis usually starts at a young age. It is an autoimmune disease. That is where the immune system of the body begins to attack the joints, causing pain, stiffness, and swelling of the joints. Multiple small and large joints can be affected. And the hallmark of inflammatory arthritis is the morning stiffness. When the person wakes up in the morning, he or she has got stiffness in the joints lasting for at least 30 minutes and sometimes for a long period during the day, till the temperature becomes a little warmer and the joints begin to ease up. The other form of arthritis is the wear and tear or a degenerative kind of arthritis, which is associated with cartilage loss and occurs as we grow older. The most common joints affected are the knees because they bear the weight of the body. So people often experience pain on activity, which is then relieved at rest. So they have pain in their knees while they climb upstairs, come downstairs, or they walk for long periods of time, or they're standing for long periods of time. So this is a mechanical kind of pain. Unlike an inflammatory arthritis, which usually the pain worsens when they are at rest. Even osteoarthritis, which is the degenerative kind of arthritis, is associated with stiffness, but it's for a very short period of time, just for about 5 to 10 minutes. The kinds of inflammatory arthritis that we normally deal with are rheumatoid arthritis and another kind of inflammatory arthritis associated with a skin disease called psoriasis, which is known as psoriatic arthritis. Now the joint as such is a very complex structure. This is where the two bones meet, but around the joint you have a lot of other structures like capsules, tendon, ligaments, and any of these structures can cause pain, which can lead to a person feeling as if the pain is coming from the joint. So in order to find out whether your pain is coming from the joint or from any other structure, it is important when you have joint pains, or you or your friends or family have joint pains, to meet a qualified health professional who will be able to assess the joints clinically and find out whether the pain is arising from the joint or the neighboring structures, and whether the joint pain is inflammatory autoimmune in character or it's a degenerative condition. Why is this important? It's important because early diagnosis helps in initiating treatment early. Without treatment, the joints may get damaged and destroyed. And also because the types of treatment that is required for inflammation, as well as inflammatory arthritis, as well as osteoarthritis or degenerative arthritis, is very different. People are often very worried about the medications that are used for the treatment of arthritis. Yes, for autoimmune inflammatory arthritis, the treatment can be long-term, but whenever we initiate medications for a treatment, for a condition, the risk-benefit ratio is always assessed. The benefit of the drug or the medication has to far outweigh the risk. It should be beneficial for the patient. Every medication is associated with some degree of adverse effects. So whenever arthritis medications are initiated, it is done after counseling the patient, and we keep the patient under careful follow-up, regular monitoring, so that if any adverse effect is picked up, it can be immediately treated, and the medication dosages can be adjusted accordingly. So none of these arthritis medications should be taken unmonitored. They have to be taken under the guidance of a health professional. Now, a rheumatologist is a doctor who actually is specialized and who is trained in the diagnosis of different forms of arthritis, musculoskeletal conditions, as well as autoimmune disease. So it is important, if you have joint pains, if your friends or your family have joint pains, to meet a qualified health professional like a rheumatologist. Another question that is often asked is about diet as well as exercise in people who have arthritis. There is no specific diet that we advocate. We do not have any food restrictions either. What we do advise is for people to take a very balanced diet with proper amounts of carbohydrates, fats, proteins, lots of fruits and vegetables, which will provide the necessary minerals as well as vitamins. This will keep the body healthy and also keep the weight under control. Why is this important? Because if the weight is excessive, it tends to stress the joints out, especially the weight-bearing joints like the hips, the knees and the ankles. It is believed that the turmeric that we use very liberally in all our Indian curries has got an anti-inflammatory property. Besides that, we don't advocate any special food, just a healthy, balanced diet. The other thing to remember is that if a person feels that a particular food item is triggering the joint pain, some of them feel that by eating this particular thing, the joint pains are worse the next day, then we advise them to avoid that particular food trigger. That is usually the patients themselves come out and tell us this history. In terms of exercise, physical activity is beneficial for all. It has multiple health benefits. It improves the mood, it keeps the weight under control, and it also keeps our muscles strong because the muscles are the supporting structures for the joints. So if we advise all our patients with arthritis that once their joint pains come under control, they should have some form of physical activity. Now this need not necessarily be marathon running and jogging. It can be something as simple as going for a walk, or it could be cycling, or it could be swimming, something that you enjoy. And always start slow and then build up. You can start with perhaps 5 to 10 minutes of exercise at your own pace per day. And then you build it up to around 30 minutes 5 days a week, which is the WHO guidelines for exercise. So normal balanced diet and physical exercise are what we also advocate for patients with arthritis. As I mentioned earlier, it is important to diagnose and treat arthritis early, because if it is not treated, whether it is inflammatory or it is degenerative, the disease tends to progress. And once the joints get damaged, then it tends to affect your quality of life. With the correct diagnosis, early treatment, these joints can be protected and you can have a healthy and a good quality of life for a very long period to come. So it is important, if anyone is suffering from joint pains, to consult a qualified health professional like a rheumatologist and get advice and treatment as early as possible.